we, our topic for physics, we wanted to know about fluids in the body and how everything is really influenced by that.
Wow. All right. So let's start with that.
Yes.
So when you think about the patient in the ICU, in the intensive care unit, whether it's what we call the etiology or the causative factor, or whether it's the end result, at some point you're going to talk about metabolic or respiratory acidosis or alkalosis, and those all have to do with the acid-base balance, and that's usually driven by fluid shifts. So the fluid in the body can be in one of three places. It can be in the cells, where it's doing its little work with the mitochondria and all that good stuff. It can be in blood vessels, where it's being transported, whether it's an artery or a vein or inside the heart, it's going somewhere. And then it can be in what we call the interstitial space, which is everywhere else. Not in a cell, not in the blood vessels, but in the spaces, you know.
A few moments later.
So, I got way off track, but all of that, you know, if a patient has, for whatever reason, the Starling's law is pushing the fluid out of the blood vessels and into the interstitial space, they're going to swell up and you get that edema, right? If it's inside the blood vessels and not in the interstitial space and not in the cells, they might be relatively dehydrated. If it's leaving the body, they're definitely dehydrated. If there's more in the vessels, they might experience higher blood pressure, right? So all those changes that are driven by what's happening physics-wise in the body. And I have to, the disclaimer is I hate physics, and I use it, I do. But I use it every day, so I can get it when it's applied. I'm not really good with the basics. So. But anyway, so yeah, physics as applied to the human body is involved every step of the way, from the cellular level on. So the first thing you think about before anything, before you intervene to relieve pain, you've got to think about what we call the physiologic demand. So by having that fluid out in the spaces where it's not really helping anything, and it's not in the vessels where it needs to be, it's certainly not in the cells, how is that impacting the patient? That patient is working harder. They're expending more energy because all of that useless fluid, it's not contributing, and it's literally weighing them down. Pain, in my realm, pain is one of the last things we deal with, because oftentimes our patients, that's not their primary problem. For my patients, they can't freaking get out of bed on their own. And sometimes pain is a component to that. If there is pain, it's often tied to effort. So then we have to go back to effort. Let me show you an easier way to do this so that it won't hurt. And then you start thinking about things like lever arms. Somebody who's laying on their back and they want to sit on the edge of the bed, the harder way would be to do, you know, a Frankenstein sit up, right? None of my patients can do that. The easier way is you using the lever arms, you roll them on their side, and then as their legs tip over, their head comes up, and voila, it's so much easier. And you'd be surprised how many people don't think about doing it that way, because they just haven't thought it through. So that's one of the mechanisms of using the physics of the body to do your work for you. But if all things are equal, if the kidneys will be able to manage the extra fluid, I'm going to get that fluid out of the interstitial space back into the blood vessels, where it can move and go where it needs to. So the way we do that, we have a couple different ways we can do it. First is always let gravity be your friend. You know, passive force is the easiest. So you'll see people in the ICU or in the Heart Institute, if it's whole body edema, you'll see their arms up. You'll always see their legs up. We have nothing but recliners in the Heart Institute. And that's because, you know, when your feet are down, gravity's fighting you. When your feet are up, that's just another way to get the blood back to the heart. Just like if you sprain your ankle, you put your leg up. The active ways we can do it, you can put compression garments. And that could be something as easy as an ACE wrap, a compression sock, to a custom-made garment. But some fashion, enough of a pressure to get that fluid out of the limb and back to the heart. And then the most active is for, well, sorry, there are two most active. The most active for the therapist to do is what we call retrograde massage. So we're moving, we're literally, you know, massaging the leg distal to proximal, so we're moving the fluid up. Or the patient can do, and this is what I tell them, you want the fluid out of your leg, start moving it. Ankle pumps, right? The patient does the active motion and muscles become fluid pumps. Okay, so in general, you need sufficient, you know, they don't have to be popped up like balloons, but you need sufficient amount of synovial fluid so that with the cartilage, because you remember when you look on x-ray there's a space there, part of that is synovial fluid, but part of it is just that there's cartilage, which isn't imaging. So you need a sufficient amount of synovial fluid, of cartilage between the bones to give you that joint space so that they're not just pounding bone on bone. What I see in my clinical practice is often less, it's not like the athlete who has a bursal rupture or synovial rupture, it's the person who they've got a degeneration, and so they've lost synovial fluid, but they've also lost cartilage, so they're getting a narrowing of that joint surface, the joint space. So why are all those structures in between the bones? Well, they're to prevent the bones banging against each other. So if I don't have them, what happens if those aren't there? Then the bones get to smack against each other, and then what happens? Then the bone starts to degrade, and that, you know, that's arthritis, right? You start to have degeneration of the joint. If I can't reduce the forces on the bone from the inside, then can I reduce them from the outside? So that's when you start talking about techniques like reduced weight bearing. I can put someone in a pool so that their whole body is afloat. I can put someone on suspended walking devices where they're, I don't want to say hung, but they're, you know, they're supported, and you can dial the machine the way we have a, what's called a light gate. You can dial the machine support so that it's anywhere from, and I'm just pulling these numbers, you know, just roughly out of my head, but, you know, anywhere from it's picking up a quarter of the body weight to 75%. I mean, you can do it where they're almost just like walking on air.